There are only a small number of conditions that cause the vast majority, significantly over 90%, of the problems that yield abdominal pain in kids. The first is related to acid. We all know in adults how common heartburn is, and what we don't realize is that the reasons that adults have heartburn are exactly the same as situations that exist for children and infants. The only difference is that adults are much more able to verbalize their specific complaints than children are. However, if you ask the child certain questions, you get large clues. Is the abdominal pain above the belly button? Is the abdominal pain in the nighttime? Ever. Not always, but ever. Is the abdominal pain typically after eating? Is the abdominal pain such that oftentimes it comes up? Is there bad taste in the mouth? All of those are important clues that what your child is experiencing is in fact related to acid. It doesn't distinguish whether the child has actually a reflux, whether the child has a stomach inflammation called a gastritis, or even if the child has a little ulcer. However, the treatment for all of those conditions are the same. So if the child is not ill, if the child does not have evidence of losing weight, if the child does not have evidence of losing blood as a result of an ulcer, if the child is not having any other types of complaints that are serious, maybe the child has stopped eating, if an infant has stopped eating, then those children will all be given a trial of 3 weeks of medicine to stop the acid, and usually it will be requested that the mom gives a follow-up in 7 to 10 days. The mom or the dad need to know that this is not magic. It won't help the child overnight. Rarely it does. It might be such bad inflammation that the kid gets some relief. But that within 7 to 10 days you should start to see some clues that things are getting better. And clearly by the time I ask them to come back within 3 weeks, that there is certainly some objective evidence that the things are getting better.
The medicine you alluded to is a anti-reflux type of medicine you're referring to?
Well, again, it depends. Nowadays, these are all available even over the counter. The simplest, the least expensive, the mildest in terms of its strength would be an antacid, like a Mylanta or a Maalox. But oftentimes one can get valuable information, since it works quickly, that this medicine is the right type of medicine because the child has the belly pain, the child leaves the dinner table, you give them the Mylanta, and they feel better pretty quickly. The next level would be what's called the H2 receptor antagonists. We all see these on TV and the radio. They advertise quite widely. And the most common ones would be Pepsid or Zantac. The older one was Tagamet. The newest one is called Axtid. And then the strongest in the same spectrum, they all virtually do the same thing, decrease acid, would be what's referred to as the proton pump inhibitors. And again, we see these advertised directly to the public. Prilosec, omeprazole, Protonix, Prevacid, Nexium, and there are...
Are any of them better than others?
If one goes within the group, then they are relatively comparable. There are certain exceptions to that, but in general, the Mylanta, Maalox, antacid will not be as potent as the H2 receptor antagonists, the Zantac, Axtid, Tagamet, Pepsid, or famotidine, and they will not be as potent as the proton pump inhibitors, the Prevacid, the omeprazole, the Protonix, the Prilosec, etc.
If someone is put on these medicine, does that mean for the rest of their life or a short period of time? What would be the normal way you would approach that kind of thinking?
Well, at the very first time, you would get a clue, but you wouldn't know with 100% certainty the answer to that question. If a person comes in who is very, very ill and has a very bad ulcer, even those individuals, the data is very good that their ulcer will heal within a month, 6 weeks, 8 weeks, and then will be able to be off of the medication. However, there is a recurrence rate. Patients who have heartburn, as we know, these are oftentimes symptoms that are lifelong, but there are other things that can be done that can try to decrease the symptoms aside from just relying on medication, and that also is part of